Hi, Jonathan Hobbs here, developer of the Hobbs Masters Needling Series and chairman of the AACP in the UK. Just want to give you a short note and a little tip or some advice on trigger point needling and dry needling. The one thing I would say, or the one bit of advice I would give people who practice that, is just to slow down and go a little bit easier sometimes. One of the things I commonly see is the use of very large gauge needles that are pistoned very rapidly and aggressively into the tissue. And yes, that is a technique and it's a very valid technique. But if we're thinking about treatment stimulus and we're putting things on a scale from 0 to 10, where 0 is no stimulus and 10 is the most stimulus that a patient can withstand, if every time we put a needle in, we're operating at 8, 9, 10 on that spectrum, it can create some very positive outcomes, but it can create some very harsh fallout from that as well. And one of the problems with a lot of the trigger point or dry needling that I see is that clinicians are so aggressive with those techniques that that individual can't function through that muscle for the next couple of days. The classic example would be needling into the calves and people pursuing those twitch responses. And when those are pursued very aggressively, that calf is very dysfunctional, perhaps for sort of 24, 48 hours after that, and load bearing and certainly explosive movement is very difficult. And if we're working in a sporting environment where we're looking to optimize outcomes, that can be a very harsh way of treating someone. So, what I'd ask you to do is to wind that approach back a little bit, insert the needle gently, just explore for the tightness. Don't pursue the twitch so aggressively, just pursue the tightness, insert the needle into the tightness, and see what happens. If it changes the outcome, and when you remove the needle, if the tension is reduced and the range of movement is increased, you can test, retest. If it's worked, great. That's all we needed to do. If it hasn't, you can always go back and do some more. But it's very difficult to come back off once you've done that aggressive style needling. So my one tip to make your needling more effective is just ease up on the speed, ease up on the tension, just go very, very gently with that approach and see what it can yield. If it doesn't work, you can always go in a little bit harder. But try that, just entertain the idea. And I'll speak to you again soon. You take care.